Welcome to the Increda-dental podcast. I'm your host, Alicia Flynn. Our goal is to make a positive impact in the dental field. I have been a dental assistant, a biller, an office manager, a scheduler, a hygienist, and a dental coach, which makes me your biggest fan. My husband was in the military and we traveled all over the United States. I had opportunities to work in many different practices, and I saw incredible practices and practices that had a lot of potential within them. Thank you for joining us. Let's dive into the podcast. Welcome to the Increda-dental podcast. I'm your host, Alicia Flynn. Now, one thing I want to let you know is that I like to talk through stories. And the reason why I like to is because when we listen to a story, we can insert ourselves in that story. And we're not as guarded as an attack on ourselves. So I like to give examples and explain situations that I've been in, that I've observed, that I've coached through, and how we can change and alter, and sometimes how we ourselves are in this story and what we can do in our practice to make things better. So I want to give an example today. We're going to call it Office X and what was happening there. Now, this office contacted us, said that they had dropped in production around 25%, and they didn't quite know what was going on. Their schedule looked full, patients were coming in, but they were having a problem in production. So we dived into this practice to see what was going on. There had been some insurance reimbursement rates that had dropped, so that was to consider. But there was something more going on here. And when we dived into it, it kind of yelled at us. And this is what happened, was that they had received a new office scheduler, and this office scheduler hadn't been trained in the way that they needed. And they were scheduling children profis for an hour. And when the insurance reimbursement rate is small for a child prophy, I've seen some as low as $29, and you book a hygienist for a full hour with that child and they're not able to do sealants, or they do fluoride or x-rays, you're not going to cover your costs. And so that was the number one problem that we saw in the hygiene department. So we had to go down and decide, well, what age is it normally that you need more than 30 minutes? And we got a baseline going. Now, this is not the same for every office, but get a baseline. You want an outline of how things should look for the day for the schedule. I like to think of the schedule as a puzzle. If someone gives you a puzzle without the picture and says, I want you to put this together, you can get the borders done pretty well. But after the borders, it's really hard to put that puzzle together. So you want to give them the details. You want to give your scheduler an outline of how the day will look. And sometimes that's going to alter a little bit from patient to patient due to the difficulty of working on certain patients or the needs of certain patients. But you need to give them a rough outline of how it should look. Because when you give them an outline, you're really helping them see the puzzle and how it looks when it's all put together. So the number one problem that they were having was in the hygiene department. They were scheduling too long for some appointments, and then most of the other appointments, they were right on target. But look at the schedule in the hygiene department and make sure you're not scheduling too long for children or for perio maintenance. Make sure that this agrees with what the patient needs. Now, in the operative department, the doctor was being scheduled, again, too long for the crowns and fillings, and they weren't really utilizing the doctor time. This is one thing we need to understand, and the scheduler needs to understand, is that there is a waiting period, a time period, where when the patient gets numb, in between that and when treatment starts, there's a little window there. And you can schedule another patient on the other side in a different chair to do a small exam, or to do a denture adjustment, or to check bleaching. You can choose what you're going to do in that area, but you can use a small 10, 20-minute window while the patient's getting numb to address another patient's need. Sometimes it's just a limited exam, or it's adjust the occlusion. Make a list, things that can go alongside while a patient is getting numb, so that way the doctor's time is being used wisely. Because a lot of times we think we need to work longer hours, we need to do more production, and often it's the way we're scheduling. It's the way that we are utilizing our time each day in the practice. Once we started changing the way we were scheduling in that practice and started scheduling true to what the patient's needs were, as well as the practice's needs were, we saw an increase in production in the practice. We saw them not needing to work so late. They were getting home earlier, but better yet, they were taking better care of their patients. The patients were happier. The team was happier. They were getting out on time, and production was actually up from before when they contacted us. We didn't have to necessarily work harder. We had to work smarter. And when we work smarter and we utilize our team and we have our staff trained and we give them the details of the outline of the day. When I say the outline, I mean like a rough estimate. So we give them an estimate of what a good schedule looks like. It will really help out our team and it'll help out the practice of the patients as well. What I recommend that you do is give some examples. Ask the scheduler, how could we schedule these patients? And let them put the patients together in what they think might be the best way. And then have your assistant do it and get them working together as a team where they complement each other. Too often I see where the assistant is at odds with the front office and they're having problems because the schedule is too packed or because they feel like this person needs more time. Give examples. Help them understand what the patients need, but also what your team needs. And when you're on the same book, when you're on the same page, when you're linked together with that understanding, you are going to be more powerful, more effective, and it is going to have a positive ripple effect throughout your entire practice. So take a minute to train your person who schedules your appointments, get them up to date, give them an outline, and get your team working together because you can complement and become almost, if you will, like a superpower, like invincible when you work together, and it becomes like a dance where you don't have to speak it, but you know what each other is doing and expected of each other. And it can be a beautiful practice when you do this. I want to let you know the reason why I started Increda-dental is because I saw my father really struggle as a dentist. I saw him struggle to make ends meet, to get patients to make their payments, to have the front office collect payments. And I don't want his suffer and his struggling to be yours. That is why I've started Increda-dental. I've worked in over 30 different practices across the United States because my husband was in the military. And I want your practice to be the practice you dreamed about when you first started on this journey. You've invested too much in yourself and in your team and your practice to have it be a burden. I'm here to help you. You can schedule a visit on my website at increda-dental.com. Thanks for joining me.